Welcome, Dr. Valentine. We really appreciate you taking a few minutes out of your day today to ask some, pardon the pun, burning questions that people have about their dogs and cats in dermatology. So Dr. Valentine lives in Calgary, Alberta. She completed a Doctor of Veterinary Medicine at the Western College of Veterinary Medicine in 2001. She did a small animal internship at the OVC in 2002. Several years in emergency veterinary medicine, went back to school again to do the residency in dermatology at the OVC, and became a board certified veterinary dermatologist in 2015. Becky's interests include antibiotic resistant skin infections and the diagnosis and management of allergic dermatitis in small animals and horses. But I know in general that there are very few board certified veterinary dermatologists in North America, probably let alone the world.
I think there's 24, 26 in Canada. The American College of Veterinary Dermatology is probably about 350 members. And then there's a very strong College of Dermatology in Europe. In general veterinary medicine for GP medicine, we're banking around 8 to 10 hours of education for a general veterinarian. And you guys know this as much as I know this. Allergies are layered and they're complicated, and they're more a management strategy than they are a cure. And if you include a dermatologist in your treatment plan from the beginning, the time to cure and the cost to cure are cut by 50%.
Wow.
So out there in Ontario, you guys have the lion's share of dermatologists in Canada, and having them a partner with your general veterinarian will get you further faster with less money and less frustration. So I know the country's a big country. Sometimes people might not have direct access to a dermatologist, but it's us going on and studying for 6 to 8 years that help us be able to wrap our head around this multi-layered disease.
Okay, so the first question, can dogs have seasonal allergies? My dog has been very itchy and nibbles at her paws sometimes.
Yes. So we have environmental allergies that are induced by pollens, trees, weeds, secondary infections, etc. And then we have environmental allergies that are actually triggered or induced or flared by food. And allergic symptoms are anything from itch to foot chewing to ear infections to recurrent skin infections. If you were trying to grab a statistic and think about primary food allergy versus those dogs who have a combination of both seasonal components and food flares, you'd be going to 70% of those dogs having a component of environmental allergies. So that's a really good, important thing to say. I 100% agree we need appropriate and high quality nutrition. And in these dogs, the question is some of the symptoms called food induced? So it's such a crosstalk between everything, but 100%. The vast majority of the symptoms that you are seeing in the vast majority of dogs will actually be atopic dermatitis or environmental allergies and not food. Now, you guys know that food, that doesn't mean food's not a role player. We can help or harm intensely with food, even if the underlying diagnosis is environmental.
Going off of some of the symptoms from allergies, we had someone ask about their dog who seems to always be licking their paws. He has a white coat, so it ends up being stained. We all know the orange-brown color around the toes on the white dogs. He's had it his whole life, but the owners are wondering if it's something that they should be looking into, treating, etc.
So the best resource for this owner is going to the Canadian Academy of Veterinary Dermatology website. And on that website, we have a new landing page called Empathy for Itch. And Empathy for Itch is an education program for owners and for veterinarians to talk about what's normal, what's not normal, what we should treat and what we shouldn't treat. So the Canadian Academy of Veterinary Dermatology has an immense amount of resources. We've been working really hard for 5 years on the Empathy for Itch campaign. And through that campaign on the website, there's some things that are available only to veterinarians. There's other things that are available to the public. And it's an amazing start point for every owner who has sent in a question. That Empathy for Itch landing site would be really informative.
Okay.
And there's also lists of where to access veterinary dermatologists, or even if you can't access a veterinary dermatologist, there's an amazing amount of support for your GP. Most likely that lick is uncomfortable. So I would say, yes, we should treat it. The staining, there's 2 reasons for the staining. One is called porphyrin, and that's a bacteria in the mouth. So the tongue is involved in some of the staining. And the other staining is usually created by secondary infections. And those can be bacterial or yeast. And I can't tell a stain unless I look under the microscope. So we always have to do cytology in dermatology. It's very frustrating often to an owner, especially an owner who's chronically in the veterinary clinic. But cytology is a very simple, very easy, very quick way for us to understand what the secondary component is and whether or not we actually have to treat that as well as the underlying itch to gain success. But yes, that licking of the paws, lots of owners end up thinking that it's boredom or, that it's maybe more of a head thing than a itch thing. And in veterinary dermatology, we want to rule out the itch before we blame it on a stress response.
Okay, so on to the next question. One of our customers has a poodle who seems to scratch particularly at night. They sleep on the bed, but sometimes on the carpet. All linens are washed weekly and vacuumed, and so is the carpet. What can I do to help them?
So often, this is not a rule in any way, but often when we see itch associated with nighttime, especially early morning, we actually really think about the house dust mite. And the house dust mite is an environmental allergen. It happens to be the #1 environmental allergen in humans and horses and cats and dogs. And it's not because the house dust mite is special, it's because of the way that allergies develop. And usually when we see a lot of licking or itching associated with sleeping, we blame the house dust mite because the house dust mite population is very high around the bed, is highest in the home where we spend our time, because house dust mites like to eat our dead skin cells that fall off of us. Some pets are very allergic to house dust mites. So you would guess, based on this story, that maybe there's a house dust mite allergen. There are interventions you can do in your home to reduce house dust mites, but at the end of the day, any allergy means that that pet just has to see one house dust mite to be triggered to those symptoms. So this is a patient that would probably benefit quite a bit by seeing a veterinary dermatologist and discussing that atopic dermatitis piece and whether or not allergy testing is the right thing to do for this owner and pet, and whether or not that's something that would help them. Yeah. So there's lots of intervention for this itch. There's lots of things we could give, but there's too many to go through. And you would have to kind of understand the pet and the owner to know which one was the right one. But we have some amazing tools in our toolbox for reducing itch.
Yeah, but if it is a dust mite, I mean, you're never going to get rid of the dust mite. So you have to kind of...
but lots of owners have that impression. True. Yeah. When we look at environmental allergies, we're looking at things that are ubiquitous. So dust mites, yeast obviously can be an allergen. It can be a trigger. Food can be a trigger. There's lots of things that could be triggering this. But at the end of the day, when we have environmental allergies, everything under that umbrella is everywhere. Mm-hmm. So a lot of owners or veterinarians start to feel a sense of futility, right? Well, I can't rid my house of dust mites. Of course you cannot. But right now, the best approach to environmental allergies is to get an accurate test. And I say accurate because you have to really be careful about who's doing the testing and how they're doing it. But if you get an accurate environmental allergy test, what we actually do is microdose pets with little bits of the house dust mites and the yeast and the trees and the weeds. And when we microdose them over time, this is called immunotherapy, they become asymptomatic. We create what's called immune tolerance. There's been 2 papers now of dogs that have actually been successfully desensitized with oral immunotherapy to food allergies, to chicken particularly.
How long does it take typically? Like, is it months, years? Like
It's a good question. When I was reading this last night, I was laughing because when you ask dermatologist questions, almost invariably, no matter the question, the first word is it depends. With immunotherapy, depends how we give it, what the response rate and time is. It takes about 9 to 12 months in the average dog to create immune tolerance, to really switch them over to not being affected by those symptoms. And about 75% of dogs respond. We have much better rates of efficacy of immunotherapy in veterinary medicine than in human medicine. In horses, 90% of horses will respond to immunotherapy by the 6 to 12 month mark. Same with cats. Dogs are a little less. So 75 to 80% of dogs will be markedly improved, if not totally symptom-free at the 12-month mark of immunotherapy.
You will have to have made sure that you've identified what that allergen is, what the trigger is first, and be confident with it before you move into that type of treatment.
Exactly. And that's why the time and money involved with getting to a dermatologist may be unattractive, but that will be your highest value test for the least amount of money that gets the targeted immunotherapy made and then controls the symptoms. Yeah.
And Hannah, have you ever come across that on the nutrition side of doing this type of treatment?
I think I recognize that paper, but I do know, like, just trying to determine what the food allergy is, like a lot of people are doing those food allergy tests.
Okay, yeah. So we need to digress here for 2 seconds. At this moment in time, there is no way to accurately test for a food allergy. Full stop. Do not spend your money on it and don't do it. Food allergy testing is coming. It just is not reliable yet.
Okay.
So at the moment, the only way to know whether or not a dog is having a food allergy reaction is an elimination diet trial. We were talking about a poodle who was licky at night on the bed. So that was giving me a hint that we had a house dust mite allergen, which is an environmental problem, not a food problem. So all this testing and immunotherapy that I'm talking about that's currently available is all environmental. I do think, though, with molecular diagnostics, we will be in a very different position in the coming 3 to 5 years to be able to target it.
Oh, it's so exciting.
Yeah.
This one was interesting. So this is an older cat, 19 years old. They've been diagnosed with atopic dermatitis, and that was since they were about 8 years old. So the cat is currently on atopica pills once a week. They're concerned about the impact on the kidneys, and there is a warning on the package that it should be used with caution in cases of diabetes and kidney issues. So they were wondering if they should be worried about their cat's kidneys on this medication, and if there's maybe a more holistic approach that they could use.
Cats are different. We've gotten rid of the term atopic dermatitis in the cat, and we now call any of these skin diseases in the cat, we've renamed this feline atopic skin syndrome or feline atopic syndrome. And the reason we've done that is because the International Committee for Allergic Disease in Animals has dug through the research and realized that there's no clinical way to differentiate between environmental triggers and food triggers in the cat. And that then makes the point of why the 3 of us are on this call together, is that food and skin are intrinsically linked. I use a lot of atopica in cats with both diabetes and renal disease. And you're right, Hannah, it's on the label, but it's the safest of any medication that we have to give in cats that have renal disease or diabetes. By far safer than any other option we have. So if this cat's quality of life is high, the atopica, in my opinion, is not having anything to do with any long-term problems. And I probably wouldn't rock the boat. If atopica is working at once a week, does the cat need it? And that would be a question for the veterinarian. Is there room to move to try to maybe go to every 8 days or every 9 days or every 10 days? Does the cat need the atopica? Because once a week is a very low dose. The risk of stopping the atopica is to have a giant flare. And if we have a giant flare, we're reaching for steroids, we're reaching for other things that are harder on the cat. So at this point, if you were going to do anything, I would only try and increase the interval between atopicas, if that.
So licking and scooting. This is an elderly Morkie. Lucy's 14 years old. She is very healthy. She's been on Tom&Sawyer since we opened. This is one of our very first customers. She scoots a lot. What can these be signs of licks or paws?
50% of dogs with uncontrolled allergies have itchy bums. And the way that most dogs itch their bum is to scoot. So if there was an environmental role player, this itchy bum could just be an uncontrolled environmental allergy. Or it could be that we just need to change our protein, or potentially, and this is where Hannah's going to have to come in, does this dog need more fiber?
And then Hannah, the interesting thing on this one is that I know that Lucy is eating Fisherman's Best Friend, which Hannah developed.
There should be lots of fiber in that one. Yeah.
So sometimes we end up going on diets that really improve our pets, and that happens for several years, and then the pet gets worse again. And we always have to look at whether or not that pet is now triggering to the protein that they've been on for so many years. And you guys also know this, right? If we have a patient who has a sensitivity to, let's say, lamb as a younger pet, and we get them onto Fisherman's Friend and they're thriving and they're doing great. Well, there's another peak in a dog's life where food becomes a problem again, and that's over the age of 8.
Okay.
So that's another kind of just thing to put into our head is, do we need to switch away from Fisherman's Friend on the protein? And then remember, there's a giant 70% of an elephant in the room here, which is environmental allergies, which have nothing to do with food. Now, we can make environmental allergies better with food. How do we do that? That's all about the gut and the skin. The better we make the gut and the better we make the epidermal barrier on the skin, the less environmentally allergic a dog will be.
We've got a 7-year-old Brussels Griffon with a skin condition that's lasted up to about 3 years. So with this, the typical signs like the dry and scaly scabs along the abdomen, haunches, and the groin. So they've done a couple different things with their diet. So they've removed poultry. They're currently on our novel protein diets as well as beef. So our venison, kangaroo, fisherman's best friend, and then our 2 beef recipes. They've got kangaroo, rabbit, and sweet potato as treats. The dog is on Cytopoint to help with the itching, but they're unsure if that's really helping. So he was on antibiotics, and what's interesting is that helped with clearing up the skin. So if you have any ideas where they could go, the next steps for them.
If the skin condition has only been going on for the last 3 years, then the dog was 4 when that happened. And there was never a problem in food or anal glands or itch or ears or feet or anything before 3 years of age. It's more likely that this dog has an environmental allergy. And Cytopoint is a beautiful medication, but when it doesn't work, it means we're missing something. When Cytopoint doesn't control the pet, it means we either have an uncontrolled secondary infection with yeast or bacteria, or we don't have environmental allergies. Cytopoint doesn't fail, it just doesn't work when we have other things in the way. The response to antibiotics was telling us that one of the consequences of this dog's uncontrolled allergy is a secondary bacterial infection. That's what you would assume. The antibiotics made the dog better, that you have a secondary problem that is contributing to the itch, which is pyoderma. And that, if we do nothing else, is going to come back. There's a lot of very good topical things we can use for pyoderma and to stop it from happening. So that's where I think this dog would really benefit from having a dermatologist involved. I would get yourself to the Empathy for Itch landing page and then try and see if there's a possibility that you could see a veterinary dermatologist. And then I guess fabric softener, I'll comment on that. We don't recognize a lot of chemical allergens in dogs and cats because they can't talk to us. So unlike humans, when they walk into a facility and the scents are too much and they start to get symptoms, we can't see that in our dogs. Ideally, you're erring on the side of caution and getting things that are low odor, low fragrance, we might call those hypoallergenic. I hate that word, and so does America, because in the United States, they've stopped the ability to claim that anything is hypoallergenic for a pet. And the reason is that what's hypoallergenic for this pet is not hypoallergenic for the next pet. So we really try to avoid that word. It's not individual based, it's more of a population based word.
So this is around sort of novel proteins. There's a 2-year-old Bichon diagnosed by a biopsy with lymphocytic. Oh my gosh. Can you guys?
Lymphocytic plasmacytic gastroenteritis.
Thank you. At 1 year old after being neutered, replace half the diet with Tom&Sawyer kangaroo. How long before we can introduce another novel protein? And which one should we try first? The fisherman's best friend, the rosemary venison. These are all Tom&Sawyer recipes.
So when we have lymphoplasmacytic gastroenteritis, in an internist's hands, they're going to want to suppress that inflammation. In a dermatologist or Hannah's hands, we're going to try to cure this dog with food, right? We want to see if this isn't a food-induced problem and on the right food that we could cure the symptoms. And if we identify what the problem is and we do a dietary challenge with a diet that the dog triggers to, yay, all of a sudden we've labeled one of the proteins that dog is allergic to. And guess what? When dogs have a primary food allergy, the average dog is only allergic to 2 to 3 proteins. For example, we all know that chicken and salmon cross-react. So if a dog is allergic to chicken, the mycoprotein in chicken is the same as the mycoprotein in salmon. So 65% of dogs with a true chicken allergy will be allergic to salmon. I want to know that, because if the dog is not allergic to salmon, then the dog can go ahead and eat salmon for the rest of its life. So I do a lot of dietary challenges to identify those 2 to 3 proteins the dog will trigger to. If they don't trigger to any proteins, then I'm going to work on environmental allergies. So I love dietary challenges, and I do dietary challenges by adding 1/4 cup of whatever protein I want to try, venison, kangaroo, lamb, fish. And I would do that twice a day, every day for 14 days. And the dog has to get to day 14 with no symptoms. If they get to day 14 with no symptoms, they are definitively not allergic to that protein. If they start to have symptoms, which can happen between 2 hours and 21 days from introducing it, then that protein becomes an X. We look at the cross reactions of that protein. And if we identify the 2 or 3 that any food allergic dog would be that would be triggered to, then we know what to avoid and we know what we can eat, and we can go on and have a really happy puppuccino at Starbucks or pizza crust on Fridays. But they have to be done with a chart. You can't stop before the 14-day, and you have to give an ample amount twice a day for those 14 days in order to throw the dog over the allergic threshold if there is one.
Okay, so it's a lot of work for the human to do. You have to stick to the plan. You have to stick to the plan for length and with respect to not introducing other things that could throw it off. A question that is so, it's interesting the chicken salmon connection is that the same for all poultry? Is there a chicken turkey connection? Because people think poultry is poultry, and if it's chicken and then egg.
I've been avoiding poultry for 17 years as a dermatologist until now, because the other thing that's crazy making is allergies are a metagenomic thing, which means that if chicken is a high allergen in Western Canada, it's basically because all puppy food is made of chicken. It's not because chicken's evil, right? And the major role players of allergy in Australia are different, right? Because all the animals that we're feeding pet foods to, all the proteins that we're using in our pet foods in Australia is different all over the world. So what the food allergy is more dependent on the environment and the exposure. The disease itself is the immune system, but what they trigger to, environmental or food, is exposure in an individual body. So the chicken and salmon, of course, that was only 2 years ago, and that was based out of some advanced science and molecular diagnostics that came out of COVID, advancing science, right? We all panicked, the world was coming to an end, and science got a boost. And out of that science and the new advancement of molecular diagnostics is how we can look at these microproteins and figure out which ones are cross-reacting. So we don't have any evidence that turkey's evil or duck is evil, right? We don't have any evidence of that. Right now, they would be different proteins than chicken for you and I, but salmon goes to me for chicken. We do know some other cross reactions. So of course, beef and bison are very similar. And then we know dogs that have a true dairy allergy, true cow's milk allergy, those dogs will most likely be allergic to lamb. So we're going to get smarter as time goes on, but these cross reactions are real. And then just to throw a wrench into it, the cross reaction of the BETV1 protein. BETV1 protein is the pollen in birch. So anybody who has hay fever typically has a birch pollen allergen. Well, guess what? The BETV1 protein is in carrots and apples. So if you have a dog with birch pollen allergy, or human, I guess we talk about it better because we can talk. If a human is allergic to birch pollen and they eat apples or carrots when birch pollen is high, they get oral allergy syndrome. But they can eat apples and carrots the other 11 months of the year and not have a symptom. And that is the allergic threshold. So the cross reactions in these microproteins is super exciting for the three of us because we're going to get smarter and be able to help pets more and more as time goes on quickly. But it's crazy making because you never know what is cross-talking.
I would go the route of not adding a whole new diet, but rather testing individual ingredients first before we decide what diets to start adding into it. Yeah, I think I usually err on the side of caution. Like if it's working right now, let's not poke the bear with a whole new recipe. The only way you're going to truly know what the issue is doing the elimination and introducing at 2 weeks at a time a different ingredient.
Yeah. Okay. So tons of stuff that we learned today. Human bond, I love that. I mean, it's one of the reasons Tom&Sawyer exists, is really having that interaction between the pet parent and the pet of the enjoyment of mealtime. I mean, we know we share food with all our friends and family, and this is what we try to do, at Tom&Sawyer with our pets, and also bring something healthier. Also try to tackle some of the problems that can be tackled through food. So I really appreciate, Becky, everything that you're doing for our pets. And Dr. Valentine is in Calgary, and I know she's got a really long wait list, but go to Pet Derm. I've been there. It is one of the coolest clinics I've ever actually been inside for pets. What Becky is doing is very needed and very cool.
It's been a nice chat, and thank you for having me.
Thank you.
Thank you.
Take care.
Bye-bye.
Bye.